One of the important lessons that's come out of many different studies is that when myeloma changes from the smoldering state to the clinical state, that very little changes genetically, which kind of causes us to really rethink our view of cancer pathogenesis. And so if you focus exclusively on the cancer cells, I think you close your mind to the reality of cancer, which is cancer is the end result of an interaction between the cancer cell, its genetics, and the cells that surround the cancer, which get changed as a consequence of things secreted from the cancer cell. So rather than focusing exclusively on the cancer cell, we should consider the whole kind of bone marrow as being diseased. Because if we consider that and treat the bone marrow with the cancer cell, its microenvironment, it opens up a whole new range of therapeutic targets where somehow or other we can manipulate the interaction between these two compartments to favor cancer control and cancer death. And recently, there's been a lot of new information about this, and it's come from single cell analysis, where we can now look at thousands of single cells and really quantitate what's happening in the microenvironment. So we always talked about the cancer cell sticking to the stroma. And a recent study from Boston has shown that the stroma is not just one cell. The stroma is up to 17 different populations of cells, each of which have different characteristics and do different things to the cancer cell. So this opens up the way of understanding the stroma, and by understanding that, manipulating it and to kill a cancer cell. And so a good example of this was the interaction of the myeloma cell with kind of osteoclasts and osteoblasts, the bone-forming and absorbing cells of the marrow. And we now know more about this, but we've always been able to use that to improve both patient survival and reduce bone disease. And I think this is one of the major advances in the last few years, which is going to significantly change our approaches to treatment in the long term.